Last month, we showed you how to take a look at an upper trapezius trigger point and distinguish it from an elevated and or subluxed first rib. And if you don't remember that, or if you didn't see it, please go back into the YouTube video series and take a look at that one. This month, I promise you, we're going to show you how to treat the trigger point in the upper trapezius as well as the elevated and the subluxed first rib. So what I'm going to do is have the patient lie down now. And you find the trigger point just like we showed you how to do last time. And you bring the arm up into this position and slowly move it around. You may have to put it on the patient's forehead and you poke into the trigger point. No, that's not soft enough. You bring it over here, that's doing better. You bring it over like that, and then it softens up really nice. And once it gets nice and soft and it doesn't hurt anymore, you have to hold the arm. The patient can't be holding their arm. So you hold it there nice and relaxed for a full 90 seconds. You actually may feel it start to thump a little bit. And when it thumps, that means it's getting blood in there. It's called the therapeutic pulse, and you hold it there for 90 seconds. And once 90 seconds is up, it's nice and relaxed. You gently bring the patient's arm down. Don't let her bring the arm down. You bring it down for her. And then when you poke into that spot again, it's not tender. And that's how we're going to treat, and that's how you should be treating a trigger point in the upper trapezius. Now let's distinguish that from an elevated or subluxed first rib. So I'm going to have the patient sit up. And now, put your arm over there and get your feet up on the table. There you go. Good. Now, let's say I've determined that the patient actually has an elevated first rib. Using the technique I showed you last month, you get your thumb right on that first rib, you take the head, and you bring her into a little extension till you feel the barrier, then you back off. You side glide her just by moving your knee to the barrier, you back off, and you rotate her to the barrier and back off. Now, what I've done is shorten the scalene muscles. And in shortening the scalenes, it gives me the opportunity to depress that first rib. The patient pushes on my right hand now. She fires her right scalenes while I gently depress the left elevated first rib. And I gently move that down toward the table. I'll hold that for 10 or 15 seconds. When I feel it's not moving anymore, I'll ask the patient to relax, take a nice deep breath, and then I'll reposition with a little bit more extension, a little bit more side bend, and a little bit more rotation each time to the barrier and back off. She pushes again with the right scalenes against my hand, and I very gently coax that rib down. Now, the only difference between an elevated rib and a subluxed rib, for the subluxed rib, it's sitting up on the transverse process of T1. What I have to do is actually get behind the rib, pushing it forward. So I set her up just like I did, completely same setup, but now instead of pushing down to the floor, I'm actually pushing forward to the front of the body while I push that transverse process off. All right, push the first rib off of the transverse process, very gently coaxing it like a boat through mud, and then I drop it down toward the floor, still using the same barriers. Okay?